Over 1.3 million Americans suffer from a disease that has no cure, rheumatoid arthritis, and women are 3 times more likely to have rheumatoid than men, and this is according to Rheumatoid Foundation. Why is this disease important? Why are we discussing this today? Is because so many people don't really understand what rheumatoid arthritis is. They think it's just aches and pains, it's not a big deal, but in reality it encompasses so much more. My mom was diagnosed with rheumatoid when she was 19, and now she's in a wheelchair due to the effects of rheumatoid. And many people really don't understand why she's in a wheelchair due to this disease, because many people just don't think that it's a big deal. Therefore, today I will teach my audience on what rheumatoid arthritis is, how it affects the body in everyday life, and how it overlaps with other autoimmune diseases. We know 1.3 million people are affected by rheumatoid arthritis, but what is it? Rheumatoid arthritis is a complex disease. We will discuss what it is and some treatments for the disease. According to Arthritis Foundation, rheumatoid arthritis, or RA, is an autoimmune disease in which the body's immune system, which normally protects its health by attacking foreign substances like bacteria and viruses, mistakenly attacks the joints. What this means is the immune system, in most cases, helps you by attacking the infection, like viruses and bacteria that normally gives you infections. But in this case, it literally attacks your own body, and it causes harm instead of help. Rheumatoid arthritis is a systematic disease, and what this means is that it doesn't just affect one part of your body, such as your joints, but it also affects your organs and affects your heart and lungs and different things like that. Rheumatoid arthritis is a chronic disease that progressively gets worse. This means it's not an acute disease such as like appendicitis, where you get your appendix out and have some antibiotics and you're better. It's a disease that you will have for the rest of your life, and it gets worse as time goes on instead of better. Rheumatoid arthritis can be treated with DMARDs and biologics. Those are the 2 most common medications. DMARDs are usually pills or tablets, and biologics are usually infusions, which you get in your vein by an IV. And a lot of times those will cause your immune system to be even lower, which makes you have infections, which we'll talk about that in a little bit. So rheumatoid arthritis is an autoimmune disease that attacks your joints and organs. Now we will discuss how it affects your body in everyday life. Rheumatoid can affect your body in everyday life in many ways. Rheumatoid arthritis commonly affects the feet, hands, wrists, elbows, ankles, and knees. These are the most common, but of course they can affect any of your joints. Rheumatoid arthritis without treatment destroys joints and organs. Therefore, a lot of people have to get joint replacements because it's destroyed the joint and you have no use of it anymore. So they go in, take that old joint out, and put a new one in, which sometimes that helps and sometimes it doesn't. And your immune system is low, and you can get many infections. This is not only due to the disease, but also the medications they give for the disease, because your immune system is attacking your body, so it can't give all of its efforts to attacking then bacteria and viruses. And then the medicine that they give you actually lowers your immune system so that it will quit attacking your body, but in return it doesn't fight off those foreign substances like it's supposed to. And lastly, we will explore how this disease overlaps with other autoimmune diseases. RA can overlap with other autoimmune diseases, which can greatly complicate this disease. And according to American Autoimmune Related Disease Associations, an autoimmune disease is when your immune system attacks your own body and includes a long list of disorders. Rheumatoid arthritis, lupus, diabetes, Sjogren's syndromes, and Crohn's disease are just a few of these autoimmune diseases. And there's, like this presentation said, there's over 100 different types of autoimmune diseases, just very many. And often they overlap with each other. Many people with rheumatoid arthritis have Sjogren's syndrome, which my mom does, and she also has lupus. And her rheumatoid is the primary disease, which is the main reason for her disability, but lupus and Sjogren's is a secondary disease to that. Rheumatoid arthritis is not just a disease of aches and pains, but a systematic disease that affects the whole body in everyday life. Today we have learned about the autoimmune disease rheumatoid arthritis. We also learned how it affects your everyday life in your body and how other autoimmune diseases often overlap with this disease. Now you know that rheumatoid arthritis is not just a disease of aches and pains, but a serious disease that does not need to go untreated.